Hi, I'm Dr. Keerthana Kalva. I'm a Chief Aesthetic Dermatologist in Inform Clinic. So today I would be discussing about pigmentation in men and what is that kind of pigmentation which I commonly see in men. So there are four things which I commonly see in men. One is melasma, which 10 or 15 years back, not many men used to come with this concern, but lately we are seeing a lot of younger men, much younger, under 30 years of age, coming with this problem, with this melasma condition. And number two would be pigment demarcation line. So in men, very often you see pigment demarcation line which starts from your forehead extending to your high cheekbone, or sometimes it starts from high cheekbone this area and it extends till the lower half of your cheek. These are the two types of pigmentation we commonly see in men, and along with that sometimes even periorbital kind of pigmentation. And the third thing is tanning. Because of the work and too much of outdoor activity, and because of your work schedule, we tend to see a lot of tanning in men at the same time. So how do we go about treating these problems? When it comes to melasma, it is very important that we also rule out your familial history, and what we notice is the younger the age group and the tougher it is to stop this pigmentation or to give you a better result. The older you are, the better the results are. So melasma usually very often it is more commonly seen in men who have lot of sun exposure and who have a family history. So to treat melasma, we advise lasers, because that is the best way you can take away the excess melanocytes which are forming underneath your skin, and once these excess melanocytes are removed, you can maintain those melanocytes with your sunscreen or your depigmenting agents. Now coming to pigment demarcation line, in pigment demarcation line, it's not just the pigmentation which you notice, but you will also see there is a thickening of your skin. There is exaggerated skin marking, there is hyperpigmentation, and the texture of your skin has changed. So how do we go about? When we treat this, we are not just targeting the pigmentation, we are also targeting the texture which we have to change, the thickness which we have to change, and as well as the pigmentation. So this is when we use a combination of lasers. We use a resurfacing laser, we use a laser which would target hyperpigmentation in specific, we use a laser which will effectively modify your skin texture, and when we do this combination, you will get back your original fine, non-hyperpigmented, thin, and a very good even skin tone is what you can see in pigment demarcation line when we do a combination of lasers. So once this is done, you can maintain with sunscreen and as well as very mild depigmenting agents. And coming to tan, a good sunscreen would do wonders, and a basic vitamin C also would be very helpful. If you are already maintaining this and if you still have a skin tan, you want something that would remove this tan, a basic chemical peeling which is actually a good exfoliant will also help. And in fact at Inform, we have a specially designed medifacials, more so for men, which would help in maintaining your pigment demarcation line, your melasma, and as well as your tan. And if you're following all this, if you still have any concern, definitely do come to Inform Clinic. Let us take a closer look at your skin and give you a right kind of decision or your advice, I would say, as to how to maintain your skin and how to put it more younger looking, more acne free, more pigmentation free, and always ready to rock kind of look.